everybody. I have divided my presentation into two parts, and I expect that this presentation will be probably longer, but I think each and everything you need to know. First part is why gynecologists face 50% of all doctors' litigations in our country. The facts behind it is that it is a fact that 80% of you doctor colleagues are behind. For every litigation, 80% of your own colleagues are behind. 50% cases can be avoided by proper informed consent, counseling, and documentation. And 50% it is because doctor gynecologists don't have any legal knowledge. I say knowledge is power. And when you have so much of litigations, you've got to have that particular knowledge. There's a lot of expectation and emotional nature of the case because gynecologists deal with childbirth and infertility. Their patients are young, healthy, and the family is emotionally charged. And the expectation of our patients in India is nobody dies natural death. All patients are killed by the doctors. Their families are often high, their expectations are often high, touching the roof. And 100% people want normal hi chahiye doctor. When outcomes don't meet the expectations, there's a greater likelihood of dissatisfaction and legal action. Complex and risky procedures. It may amount that the cesarean section is a very simple procedure, but the cesarean section is the most unpredictable. And so are the hysterectomies done for endometriosis, chronic PID, and cancers. Fertility treatment these days don't go normally. They also have complications. And even if complications arise, which are mentioned in books, patient may blame the gynecologist and seek legal recourse. Unpredictable outcome is there as far as pregnancy and labor are concerned. We all know about it. Normalcy is a retrospective phenomenon. Labor-related complications, birth injuries to the baby, or maternal health issues before and during can lead to lawsuits if the patient believes that the care provided was substandard. Communication is a big issue. Communication is not taught in the four walls of medical college. Effective communication between healthcare providers and patient is crucial for managing expectations and preventing misunderstandings. Gynecologists sometimes struggle to communicate complex medical information clearly to the patient and to their family, leading to a lot of dissatisfaction and potential legal actions. As far as the consent is concerned, 90% of my gynecologist colleagues still believe that the consent of the husband and the family is required. No, it is the patient's signature are the most important. If you have not taken a patient's signature for any procedure, you have not taken a consent. It should be informed consent. Cultural and societal factors also play in India. Families might pressurize gynecologists to deliver specific outcomes due to cultural preferences. You all know son preferences and other things. And dissatisfaction can escalate into legal action if these preferences aren't met. There can be delayed diagnosis or misdiagnosis. Gynecological conditions including cancer, especially the ovarian cancer, reproductive health issues like ectopic can sometimes be misdiagnosed or diagnosed later than desired. Such delays can lead to worsen the health of the woman and legal claims for negligence. Informed consent issue is a very critical issue. Gynecologists may face legal challenges if the patient believes that they weren't adequately informed about the risk, benefits, and the alternatives to treatment before undergoing a procedure. This is called informed consent. Medical complication and adverse events can occur even when the gynecologist is well trained and provides the best of care. If the patient experiences adverse outcomes which are written in books, they might question the quality of the care received. Lack of standardization. Let me take an example of AUB. Though it is steps of the ladder, some people suggest Marina, another person suggests hysterectomy because the diagnosis is hyperplasia of the endometrium. And in this particular process, the patient gets confused. Don't ever think that your patient does not has other consultation other than you. And this can contribute to medical negligence and claims. Now, deaths and damage caused by your treatment or surgery, 100% is an unacceptable both for the mother and the child as far as the community is concerned. Now, societal awareness has increased lately. Public awareness about the patient rights, the medical negligence, and so many legal options available. Let more legal action, this lead to more legal action if they believe they have received inadequate care. And lastly, it's a money game. The community thinks gynecologist को जरा सा झाड़ेंगे भी तो पैसे झाड़ने लगेंगे. And they think they are kings and there are many options before him or her. They're endless. They can open a war against you on the 15 fronts. To sum up, why obstetric litigations are increasing? Because the gynecologists have to deal with two lives at the same time. Deviation from normal is a retrospective phenomenon. Acceptance of adverse outcome is much less in public. And follow-up pregnancy plus 6 weeks postpartum is a long follow-up. And the patients are young and healthy. My experience of remaining expert of DMC for 2 decades and now MCI and NMC for the last 7 years is that 50% litigations are in obstetrics are related to postpartum hemorrhage. Then perinatal deaths, birth asphyxia, cerebral palsy amount to 20% of litigations. Errors or omission in ultrasound screening and diagnosis amount to another 10%. Retained swabs and MOP make it 10%. And errors in diagnosis, errors or omission in antenatal clinic diagnosis, antenatal care of high-risk pregnancies there. As for the gynae is concerned, sterilization and contraceptive failure, if you have not counseled your patient well. Incomplete MTP, perforation during MTP, undiagnosed ectopic pregnancy, improper indication for hysterectomy, retained foreign body or swab, delayed or wrong diagnosis of malignancy. So in conclusion, though 50% litigation cases are against gynecologists, only a small number have a valid claim of medical negligence. But they have to go through this long, tiring journey of courts visits. Many gynecologists provide excellent care, but the complex and the emotional nature of their field, young and healthy patient, combined with various external factors like your colleagues initiating in 80% of the litigations, can lead to higher incidence of legal claims. Effort to improve consents, communication, patient education, proper documentation, and adherence to the best practices can help mitigate these issues and reduce the frequency of legal cases. Now, coming to the second part of my